than drug-free schools. Mr. Speaker, I rise today to share with you stories from Colorado's 2nd Congressional District about why we need health care reform urgently. I was written by one of my constituents, Anastasia Gonzalez of Thornton, Colorado. Anastasia is a single mom and a full-time student. She wrote to me to let me know how important it is that in our country we put our differences aside and fix our health care system so that everybody, not just the people who can afford it, have health care. Anastasia told me the story of her child who just started school this fall. Anastasia had to borrow money from friends just to get her child immunized before school started. Anastasia hasn't been to a doctor since she had her daughter. She can't afford to see a doctor, no less have any necessary procedures done. When she was pregnant, she was diagnosed with precancerous cells on her cervix. She had a procedure done right after the pregnancy in hopes that it would take care of the problem, but she has been unable to see the doctor for any follow-up because she can't afford the fee. She doesn't know if it's developed into cancer or not. She doesn't know if she'll be around to tell her story to her child when she's old enough to know. Anastasia writes that no one should have to go through this. No one should have to sacrifice their health for any reason. Well, I'm proud to tell Anastasia that the bills before Congress today would make a real difference in her life. The affordability credits would provide vouchers that would enable her to have the resources she needed to buy the insurance of her choice. She wouldn't need to worry about being discriminated against in pricing for her pre-existing condition. She would be able to be covered and ensure that she was there not only for her daughter but for her granddaughter and for her family, and was able to go to sleep every night knowing that she had access to the very best medical care in our country. Thank you, Mr. Speaker.